Couche, and good evening, everyone. This is John Lasher from Partners in Health Sierra Leone. Today is Wednesday, May 27th. Today in Sierra Leone, there were 28 new cases of coronavirus, bringing the total number of cases up to 782 in the country. Since the last update, there have been many more cases reported across the country, and most notably, for our purposes, there are now confirmed coronavirus cases in Kono District. Today, we're going to be joined by Dr. Marta Patino. She is an internal medicine physician from Spain, and she has been working at Koidu Government Hospital with Partners in Health for 2 years now. Marta was at the hospital when the first cases of coronavirus were confirmed, and she's now in quarantine. So she's 1 week into a 2-week quarantine because one of the 4 confirmed cases was a healthcare worker, and Marta is one of the secondary contacts of that positive case. Marta will be telling us a little bit about what it means now that Kono District has their first coronavirus cases.
Hello.
Hey, Marta, how are you?
I'm fine.
But you're okay? You're okay in quarantine? You're at home?
Yeah, I'm okay. I'm having time to do a lot of work and time to think about important things. So it's not so bad. Okay, it's not so bad.
Good.
Let's see next week. You know, it's like today is 7 days, so let's see what happens in the next ones. But I think I'm going to be okay.
Thanks for taking some time to come on the audio update. So just want to jump right in because I don't want to take up too much of your time. So can you walk us through the past week at Koidu Government Hospital? How many positive cases have there been?
Well, this last week has been like very challenging and somehow stressful too. So the first case was diagnosed at KEH in one of our nurses, and the day after, two new cases were detected in the quarantine house, and also other patient that already was in the isolation area. I think the main concern is like 2 out of these 4 patients didn't have any history of traveling out of the district or having contact with anyone coming from other districts. So that means that there is a possibility of community transmission already now in Kono District.
And are you expecting an influx of patients now to the hospital with coronavirus?
Yes, like we are expecting like an influx, but until now there are no new cases, and it's like we are going through the next week from the first case. So let's see what happens. But yes, we are expecting more cases, of course.
Wow. And how has the confirmation now that coronavirus has reached Kono District, how is it affecting patient care at the hospital in general?
What happened after the diagnosis in our nurse working in the emergency department is like right now all the health workers in contact with this nurse, including myself, have been isolated, and the emergency department is now closed. Okay, so these actions have a direct impact on the patient care because right now the attention to severe acute diseases is not idealistic, okay, because the place and the people that do it possible are temporarily out of work. But we are working on that, and we are thinking about trying to open the emergency with other people and try to find a solution for this situation that we have right now.
Trying to understand a little more about why it's so dangerous for a healthcare worker to get coronavirus.
Okay, so I think the healthcare workers are essential frontline workers. So we provide care, and we have one of the highest occupational risk of acquiring the infection and also transmit it to our colleagues and our patients. So we can become vectors in the transmission. And this is the reason it's so important to protect us, no? Because the benefits of that are like we sustain the capacity necessary to care for other patients, and also if we keep us safe, we can prevent nosocomial spread to our patient and other staff members. So I think the good news is because there are always good news in general in life, no? Is that if we are able to follow strictly the infection prevention and control measurements, the risk clearly decreases.
So since the nurse tested positive at Koidu Government Hospital, what's happened to the healthcare workers that were working there in the emergency department?
What happened right now is we are all in quarantine. So we are not working at the hospital, and we are in a house in Salevi, 4 of us, and the rest of people are living in a hotel. And the surveillance team is doing follow-up of symptoms of all of us. We are asymptomatic, all of us, right now, and we will be tested next week and to see if we are positive or negative, and if we are negative, we can come back to work.
And so there are 4 cases now, and hopefully there won't be more, but we expect more cases. Are there plans in place at the hospital to prevent additional quarantines of healthcare workers, or what's going to happen, do you think?
So what we are doing now is trying to work in a plan to increase the IPC control in the hospital. So the thing is this situation is very difficult for us because we need to find the balance between preventing COVID-19 transmission in the hospital, protecting our healthcare workers and vulnerable patients, but maintaining adequate staffing levels to provide adequate care to all COVID and non-COVID patients. So what we are doing right now is trying to sit down and to agree about what is the best approach to that. We don't have a proper answer yet, but we are working on that, and I think we will find the best possible solution in the next phase.
So I know earlier in the outbreak, when there were far fewer cases, the protocol was to send all positive patients to Freetown. But now there are positive cases in Kono, and they're all luckily asymptomatic. But has the protocol changed? Will we be treating coronavirus now in Kono?
Yeah. So what we have actually is the treatment center at KEH. And also we are going to open a community care center close to Doma. So the idea is we are going to divide the positive patients between the severe cases that are going to be at the hospital and the asymptomatic of moderate cases that will be hospitalized in the community care center.
And have the staff been trained at the hospital to manage coronavirus?
Yes, we have done training in Dunning and Dauphin, and we are actually running a training focused more in the management of the respiratory complications that are the most common in COVID patients, and also shock and cardiac arrest. Okay, what makes me nervous? Well, I think there are several things. The first one probably is the risk of loss of losing common sense, to approach the challenges. Also, the feeling sometimes that we are going behind the disease. Also makes me feel nervous to lose the confidence on the population, to lose the confidence to come to the hospital, to feel safe, to consult when they have problems. And also makes me feel nervous the consequences of the fear and the necessary changes in the functioning at the hospital. I mean, this idea of wearing masks all the time, not sharing places, not eating together, not touching patients, not sitting on the beds with them. No? I think we need to learn how to give them affection with our covered faces, how to live in this semi-isolation, and how to laugh about all this mess. What makes me feel hopeful is this has an end. This is going to finish in some moment. Almost, I think the entire world has gone or is going right now through the same situation, and they are managing the challenges, the problems, the bad days, the good days, the death, the lockdown, and they are surviving. No? We are not going to be different, and also this is not like the first outbreak in the history of the world, and also it's not the first outbreak in the history of Sierra Leone. I trust unconditionally that everybody is trying to do its best, and this gives me a lot of confidence in the future.
And the last question, Marta, what do you think the future holds in the short term for Koidu Government Hospital because of the coronavirus outbreak?
So right now we're trying to keep as much as possible the normal functioning at the hospital. So what we stopped right now is like basically the clinical meetings, so the lectures with the CHOs, the mortality meetings, and also some of the quality improvement plans are now in standby. But I really think that when the situation is more calm, everything will come again. So I think now it is time to focus in stopping the transmission of infection, giving a good care to our COVID and non-COVID patients, keeping our staff safe. And there were a lot of good advances at KDH in the past and many plans before COVID. And I think all of them will reappear after COVID, or even COVID when the situation is more controlled.
Well, thank you so much, Marta. Thanks for joining the audio update from your quarantine. We're, very proud of our clinical team. And if there's anything more we can be doing to support you, let me know, please.
Okay, thank you so much. And thank you hello to all PIH staff all over the world. Bye-bye.
Bye, Marta. Thanks. Thank you very much to Marta for taking time to join us while she's in quarantine. Wishing her an easy rest of the quarantine. It's 7 more days for her and the rest of the nurses that are quarantined. And we're also happy to report that the positive cases of coronavirus in Kono, all of the patients are doing well. We'll be back very soon with more updates. Thanks, everyone.